Module 20 will describe the known and hypothesized effects of skeletal muscle action on glucose uptake and insulin sensitivity, and describe and evaluate the strength of evidence that physical activity and exercise training improve glucose use and lower risk of type 2 diabetes. For diabetes management and diseases prevention, the management triad has emerged, which is composed of medication, nutrition, and exercise. Please note that exercise is one of the ingredients that contributes to diabetes management. When treating diabetes, individualized insulin administration and monitoring if needed may be adopted. As mentioned earlier, several major approaches include well-balanced diet, regular exercise and physical training, drugs like sulfonylureas, biguanides, and weight loss. Here we will focus on exercise and physical activity. Given that skeletal muscle is a huge site of glucose disposal, exercise can have a beneficial effect by upregulation of blood flow and facilitation of the insulin signaling process. Following exercise, the improvement in glucose uptake stays elevated. Specifically, insulin sensitivity is enhanced 16 to 38 hours after exercise. This effect occurs even in unfit people. A number of clinical studies indicate that lifestyle interventions of which physical activity is a part suggest that the development of type 2 diabetes can be prevented or delayed. Physical activity is a beneficial part due to increased insulin sensitivity and/or weight/body fat loss. However, is it the weight loss or the physical activity that was the causes the improvements? There is good evidence, however, that insulin sensitivity can improve due to exercise alone. In people with type 1 diabetes, exercise may or may not improve their glycemic control, but will help lower their risk for coronary artery disease. Physical activity participation has no direct effect on glucose control. Proper timing of exercise would be beneficial for insulin. Patients should avoid strenuous exercise before bedtime. Blood glucose concentration must be carefully monitored during exercise in people with type 1 diabetes so that they can alter their insulin dosage. Attention to foot care is especially important for individuals with type 1 diabetes due to decreased sensation and peripheral blood flow in the feet. Since exercise improves insulin sensitivity, type 1 diabetics have to be very careful. Type I diabetics are susceptible to becoming hypoglycemic. Exogenous insulin is more effective. Exercise may work too well and can cause hypoglycemia. In conclusion, patients with type I diabetics can exercise, but they should be careful with pre-exercise insulin levels, and should adjust carbohydrate intake before, during, and after exercise, as well as monitor blood glucose carefully. Type 2 diabetes responds well to exercise. Regular participation in physical activity improves physical fitness, increases self-confidence, improves cardiovascular function and coronary heart diseases risk profile. Exercise improves glucose control, including improving insulin sensitivity and increasing GLUT4 glucose transporters. Membrane permeability to glucose improves with exercise, likely associated with an increase in GLUT4 receptors, which decreases the person's insulin resistance and increases insulin sensitivity. Therefore, regular participation in physical activity plays a crucial role in preventing and managing type 2 diabetes. High cholesterol levels may be a sign that you are at higher risk of heart disease and stroke. Whilst cholesterol levels may rise for a number of reasons, high cholesterol levels over a period of years is often associated with a greater risk of health problems. Cholesterol is a type of blood lipid that forms the membrane of each cell of the body. Cholesterol is carried in the blood by proteins called lipoproteins. Lipid panels include total cholesterol, low-density lipoprotein, or LDL, high-density lipoprotein, or HDL, and triglycerides. LDL is often referred to as bad cholesterol, because it is this form of cholesterol that can build up in blood vessels. The optimal LDL is less than 100. HDL is often referred to as good cholesterol, because it helps to clear excess LDL out of the blood. The optimal HDL is greater than 60. Triglycerides are another form of blood fat, and are also measured when a cholesterol test is taken. It should be less than 150. Total cholesterol is the figure of all the different blood fats added together. This is shown in the first upper left table on the slide. It is preferable to have greater than 240. A cholesterol test, which measures total cholesterol, HDL cholesterol, Non-HDL cholesterol and triglyceride levels should be performed at least once every year for people with diabetes. How to reduce risk of cardiovascular diseases via lipoproteins? According to dietary studies, reductions in LDL can be accomplished through decreasing fat intake, particularly saturated fat, and decreasing cholesterol intake to less than 200 mg/day. Weight loss is positively associated with decreased LDL and triglycerides, and increased HDL. Increasing physical activity participation can also decrease LDL and triglycerides, and increased HDL. According to American Heart Association and AXIM, it is recommended that patients with type 2 diabetes should engage in 30-minute moderate-intensity physical activity for 5 or more days of the week. This slide illustrates the nutritional factors that affect LDL as well as the dietary recommendations for achieving desirable blood lipid profile. As we can see from this table, research evidence shows that engaging in aerobic exercise can facilitate decreased LDL as a result of acute effect and chronic effect, and reduce triglycerides by 20% for acute effect and 24% for chronic effect. It will also enhance HDL by 10% in acute effect and 8% in chronic effect. Yet, there was no significant effect on total cholesterol. In light of effects of resistance training on glucose level, currently there is not enough information to come to a conclusion. There may be some beneficial changes if resistance training can decrease body fat and increase lean body mass. Overall, a combination of lifestyle and pharmacological interventions is generally recommended, depending on how high total cholesterol and LDL are. In general, lifestyle intervention should include both diet intervention and exercise intervention. Effective diet intervention can decrease total cholesterol and LDL, whereas effective exercise intervention would enhance HDL and reduce triglycerides. In addition, health professionals can potentially reduce the dose of drug if lifestyle interventions are effective. Well, here we will talk about exercise prescription for diabetic. Below are the guidelines in preventing diabetes. First, individuals should engage in aerobic activity for 30 minutes, extended gradually to 60 minutes, every day or most days/weeks/150 minutes per WK. Heart rate during activity should be gradually increased to reach 60-70% of heart rate max. Additionally, exercise sessions should include 5-10 minutes of warm-up and a 5 minute of cool-down. Also, exercise must involve most major muscles in both lower and upper parts of the body. Fourth, exercise must be regular, as benefits are diminished after 1-2 weeks of stopping. Fifth, moderate intensity weight training program is recommended to maintain muscle strength. It is recommended to engaging in weight training at least 2 times/week with 8-12 repetitions for 2 sets of 6-10 exercises. Also, for those with feet problems, avoid running. Rather, they can alternate between walking, swimming, and cycling. Use proper shoes, with silica gel or air-filled soles, and always keep feet dry. When using insulin, avoid exercise if glucose levels below 100 mg per deciliter or above 250 mg per deciliter. Do not inject insulin into a body part that is expected to be used during exercise. Avoid dehydration by keeping your body always hydrated. Finally, it is recommended before any moderate to high-intensity exercise, especially if the patient's age is over 35 years old, type 2 diabetes for more than 10 years duration, type 1 diabetes for more than 15 years duration, presence of any coronary heart disease risk factors, presence of microvascular disease like retinopathy, nephropathy, presence of peripheral vascular disease,